Well, now to this, the journey of a cancer survivor often extends far beyond the triumphant ringing of a brass bell, signaling the end of treatment. Sonia Goins was treated for her HER2-positive breast cancer in 2020, and a lot has changed in her life since then. Mayo Clinic's Dee Steepen has her story.
I thought once I rang that bell, it was over, but it wasn't over.
A few months after completing targeted radiation treatment for breast cancer, Sonia noticed swelling in her lower arm.
And I wasn't sure what it was, and they told me, hey, you need to come into the emergency room. It might be an infection. And I went into the emergency room, and they're like, no, it's lymphedema.
Lymphedema is a chronic and debilitating disease in which tissue swelling is caused by an accumulation of fluid that's usually drained through the lymphatic system. About 40% of people who undergo breast cancer surgery, where their lymph nodes are removed, will develop lymphedema.
It was painful. It was hard to sleep because it just felt like my arm was like thumping all the time. And I noticed, like, particularly at the end of the day, like I type a lot for my job, and I noticed like my arm at the end of the day would swell up. And to be honest with you, it was a little disheartening because I thought, hey, this is over because, you know, you got the cancer's gone. But now you have to live with the after effects.
But she didn't have to live with it. Sonia did some research and reached out to her Mayo Clinic care team. She found out about a surgery to help patients with lymphedema.
When I met Sonia, she already had stage 2 disease.
Dr. Vahe Fahradian is a Mayo Clinic plastic surgeon who specializes in breast reconstruction and lymphedema reconstruction.
In her particular case, because she had some remaining functional lymphatic vessels, we decided that we're going to be able to do lymphovenous bypass surgery for her.
Using special dye to identify the lymphatic pathways, surgeons use small incisions to reroute the lymphatic system by connecting tiny lymphatic vessels to tiny veins, creating a detour around the damaged lymph nodes. This new connection restores the body's ability to drain lymphatic fluids.
I'm actually surprised at how well it worked.
While lymphedema is considered an incurable disease, getting outcomes like Sonia's, where patients can easily manage the symptoms and improve their quality of life, is the ultimate goal.
My symptoms are so minimal. I mean, I've gotten back to like working out and stuff, and I'm able to swing kettlebells, and which I couldn't do before, and my arm does not swell up at the end of the day. So that's amazing to me.
And you're able to sleep better?
I'm able to sleep better, and there's no more pain.
One major key to achieving that is early diagnosis.
Well, the message is that if you notice that you have a arm swelling or breast swelling or the lower extremities, it is not normal. You don't have to live like this.
For the Mayo Clinic News Network, I'm Dee Steepen.